So I'm hoping that by the time they leave, they would have seen as many as possible and more so in the hundreds. Oh, the plan would be so that people who have preventable eye diseases are really taken care of, so that those who are having eye diseases from our non-communicable diseases. Like I said, sometimes one of the first manifestation of diabetes is we see it from the eye, is the eye manifestations. So if we can really take care of that, then it would tie into our Mahama Cares, which is a Ghana Medical Trust Fund, which is for people with non-communicable diseases. 40% of all mortalities in Ghana is from non-communicable diseases. So having a good plan for the eye, people who do eye screening or eye care, before it even becomes a problem, and when they develop a problem, that we have a policy that will help them in terms of even the funding of their eye problems. I think that will be perfect along the line. So we're working on something like that.
This is the fourth Flying Eye Hospital project in Ghana, but there's also an Orbis Ghana office who've been working in Ghana with the Ministry of Health for over a decade. And with this project, we're going to do many things. We're going to teach over 115 local eye care professionals. We'll be teaching ophthalmologists, nurses, anesthesiologists, and biomedical engineers. But we can do more than that with this project. We can also raise awareness about the importance of eye health and about the availability of eye care services in the public health system here in Ghana. What we're doing at the aircraft is set up specifically to deliver training to local eye care professionals. So what we're doing is we're working with our partners here with Korlebu in Accra and with CATS in Kumasi. And we're also inviting doctors and nurses from 23 other hospitals right across Ghana. And they're traveling to Accra and Kumasi to receive that training. Our goal at Orbis is that when we finish the Flying Eye Hospital project, those surgical skills will remain with the local eye care professionals. So people will be able to access those services through the public system of Ghana. So there is, we have a virtual reality simulator. It's for a cataract procedure, which is a common procedure here in Ghana for treating cataracts. Orbis has co-developed that simulator, and we're donating 2 of those, one to each of our partners, to Korlebu and to CAT.
So this Flying Eye Hospital project comes in to complement the work that Orbis International is doing in Ghana, and everything is built into each other, that the Flying Eye Hospital supports our ongoing efforts here. So with regards to the training participants, we have a very close working relationship with the Ministry of Health, and then also with Kompanochi Teaching Hospital and Kolebu Teaching Hospital and the Ophthalmic Nursing School. And with selection of participants for this training, this is also, first of all, I will talk about the subspecialties. And so in selection for subspecialties areas, we engaged all our partners, and then they provided their input, and then areas that we should focus on. And so we worked with them to identify participants from our partners, because their participants that they identify are the ones who are going to deliver the services post project. So that's all form part of the the planning process, and then the selection process that our partners have shared with us, and then we are working very closely with the participants that our partners have selected based on their needs and then the available human resource.